Doctor, many women assume they'll feel the common symptoms during pregnancy, like nausea, fatigue, but bleeding. What about bleeding? Because that's also a common symptom. What does it necessarily mean?
So, bleeding is, of course, scary, and it's usually not normal during pregnancy. During the first trimester, the only bleeding you should expect or see would be implantation bleeding.
Okay.
And that is usually 1 to 2 days of spotting, which means maybe 1 tampon a day, 1 pad a day for 1 to 2 days.
Okay.
And that's it.
But some women don't even experience bleeding during pregnancy.
Correct.
So it's not always a telltale.
Right. It's not always a telltale sign. Only 15 to 25% of women experience that.
Okay.
And then that's it.
Now, when is it time for you to go to see your doctor if it's looking a little unusual?
If you're bleeding more than 1 pad per hour,
1 pad
in
per
2
hour.
hours,
Okay.
you need to go see a doctor.
Wow. Now, according to the American College of Obstetricians and Gynecologists, 15 to 25% of women experience bleeding in their first trimester. So bleeding during pregnancy doesn't always mean that there's a problem. There shouldn't be a case for alarm or a phone call to the doctor?
Correct.
Okay.
So if you're spotting, it might be okay. It could be a subchorionic hematoma.
Okay.
It could be implantation bleeding. But if you're bleeding more than that, then you definitely need to see a doctor.
So let's first focus on implantation. So what are the first signs of implantation?
So implantation bleeding is basically when the embryo is coming down and inserts into the wall of the uterus.
Okay.
That happens usually on day 7 to 9, and then it's variable, obviously, from every cycle. And that takes about 2 days. So you'll get a little bit of spotting for 2 days, as you can see in the diagram. And then that should only cause some little brown discharge or maybe a little bit of old blood. So you'll never see bright red blood.